Okay, na?
Okay.
Good morning, everyone. I am Dr. Murali Chand from India. Today, I talk about facial recess. This is very useful in our cochlear implant surgery and cholesteromas also. Okay, this is our index finger. This is index finger. This is a sign of pointing something. So, this index finger is analogous to our short process of the incus. Now I am showing you two fingers. Point here. Focus here. Focus here. Now I am showing you my left hand two fingers. Index finger and middle finger. See, these two are not in the same plane. This is facial nerve. This is cauda. See, this is like this. The facial is somewhat deeper and this cauda is anterolateral to facial nerve. Now the point is, how aberrant the facial nerve may be, the cauda is always anterolateral to facial nerve. How aberrant, I am repeating again, how aberrant the facial nerve may be, that means in abnormal facial nerve courses also, the cauda is always anterolateral to facial nerve. Now this index finger of my right hand pointing to second genu. This is vertical part of the facial nerve and this is cauda. This index finger of my right hand, that is the short process of the incus, points to second genu. This point is the second genu. This is second genu. So my index finger, short process of the incus, pointing towards second genu. Okay. Then there is a triangle between this facial nerve and cauda and here short process of the incus. This is the triangle. Again, this triangle is again divided into two parts by a small ridge of bone that is called inside, that is called caudal crest. This caudal crest divides this facial recess into upper space, here upper space and lower space. See, like this. Suppose here this is caudal crest. I can focus here. So this is, can focus. The upper space, this caudal crest inside divides this facial recess into upper space and lower space. Always one cell present in this upper space and this lower space is bony. This caudal crest attaches to the cauda and pyramid behind. The pyramid, it attaches to the pyramid and caudal bone. So this caudal crest, small ridge of bone here, this caudal crest, the pen is caudal crest inside, divides the facial recess into upper space and lower space. Again I am giving a statement, how sclerotic the bone may be, always one cell, sentinel cell present, one small cell present in the upper space. All you need to do is just dilate that cell. Once that is open, you just dilate that cell. Once you dilate that cell, you will see IS joint. Okay, na? Next, when you are drilling here, when you are coming below, that means caudal end, the space is reduced. So this point here is the potential area of facial nerve injury. Your burr may injure or your burr shaft may injure this part of the facial nerve. So what happens is, when you are doing cochlear implant surgery, when you are trying to appreciate the round window, you are more focused towards identifying the round window. You may not concentrate here the facial nerve. So when you are coming below from above, from this sentinel cell, that means once you have viewed the IS joint, when you are trying to locate the round window, you are in a more focused that you more focused towards identifying the round window, and you may not identify the injuring of this facial nerve. So when you are coming caudally, this space is reduced, this facial recess space is reduced. So this area, the point what I want to stress is, when you are coming down, when you are trying to identify the round window, there is potential chance of injuring the facial nerve here. So be cautious. And whenever you get a spurt of bleeding, small spurt of bleeding, or when you identify the epineurium, so you can stop there. So nothing will happen once the epineurium you identify. Epineurium is a boon to our facial nerve dissection. Okay, na? So the point is, the facial recess is again divided into upper space and lower space by caudal crest, which attaches to the caudal bone, cauda bone, and the pyramid, or here the bone just anterior to the facial nerve. You will identify when you are doing the facial recess. You can identify. And there are two statements. I am repeating again, like this. Always cauda is anterolateral to the facial nerve, how aberrant the facial nerve course may be. That means how abnormal facial nerve course may be. That is point number 1. Point number 2. Always one cell present above this caudal crest, how sclerotic the bone may be. I asked senior most surgeon, what they said is, very rarely you may not identify. So usually 99% of the times you can identify the cell, sentinel cell here. So from this side, this is the short pulse of the incus, and this is vertical part of the facial nerve. So in this area, once you identify the short pulse of the incus, here you can drill. Initially you will appreciate the mucosa, and just you follow that mucosa, you will appreciate the cell. And all you need to do is just dilate that cell. That's it. And this pointer, short pulse of the incus, exactly points to the second genu. Okay, thank you. Okay, now again, for better visualization from different direction, I am showing again this facial recess triangle. So this is vertical part of the facial nerve. This is cauda. The cauda is always anterolateral to the vertical part of the facial nerve, how aberrant the facial nerve course may be. Now this is inside the caudal crest. Now you can appreciate upper space and lower space. This in the upper space, always you will appreciate the sentinel cell. In the upper space, always you appreciate the sentinel cell. All you need to do is dilate that cell. How sclerotic the bone may be, you will get one sentinel cell. Centric. This is upper space above the caudal crest, always one sentinel cell present, and this is bony part. So when you are drilling caudally, there are higher chance of injuring the facial nerve here. And this is my right hand index finger. This always, this is short pulse of the incus. This always points to the second genu. So the point is, this short pulse of the incus is in line with vertical part of the facial nerve. So once you identify the short pulse of the incus, stay little bit anterior and try to identify the mucosa of the sentinel cell and track that cell and dilate that cell. Then what you need to do is drilling the caudal crest bone present between the cauda and pyramid. Once you drill the caudal crest, all you need to drill is this triangular bony part, and with the shortest burr you slowly you drill inferiorly when you are trying to identify the round window here. So at that point there is potential chance of injuring the facial nerve here. Okay, thank you. See, when you are drilling this lower space, when you are trying to identify the round window here, this is caudal crest. The bone, small bone anterior to this facial nerve and inferior to the facial nerve, you need to drill. Then only round window is appreciated. Sometimes it is very easy to identify the round window. In grade 4, grade 3 round windows, you need to drill the bone anterior to this facial nerve and inferior to this facial nerve. Then there is potential chance of injuring this facial nerve. So when you are drilling the bone anterior, inferior to the facial nerve, you have to be very careful here. Thank you.